I'm Joy Pierzynski, and I'm the clinic director of the OSU Plant Disease and Pest Diagnostic Clinic, and we're located out here on the Ohio Department of Agriculture campus in Reynoldsburg. What we'll be talking about today is a very common fungal pathogen on spruce and fir trees that we're seeing across Ohio, and we've been seeing this disease for the last year, and it's Rhizosphaera Needle Cast. So I'm standing next to a tree that has both healthy branches and branches affected by Rhizosphaera Needle Cast. And just to my right here are some of the healthy branches of the tree, and over here the tree's been affected on the lower portion of the tree by the Rhizosphaera Needle Cast. This pathogen attacks the innermost needles and begins at the lowest part of the tree. And the needles turn brown to purple and drop off the tree. This disease does not attack the newest growth on the tree, and it leaves the tree almost completely bare inside with just the newest growth on the tips. So there are other diseases on conifers that mimic this disease, and so you'll want to make sure that you get a confirmation of Rhizosphaera Needle Cast before you apply any of the treatment management options. So say you have a tree in your backyard that looks like this. What are your options? Well, you'll want to cut a sample showing the symptoms and send it to the clinic to confirm the diagnosis of Rhizosphaera Needle Cast before treating for the disease. So if your report comes back positive for Rhizosphaera Needle Cast, let's remember what environmental conditions favor this disease. Cool, wet, humid weather favors the development of this disease. A few of the treatment options may be to open the space up to increase air circulation. If you have a planting of spruce or fir that are planted tightly together, opening that planting up to increase air circulation will decrease the amount of time that water sits on the needles and promotes disease development. In addition to opening up the planting to increase air circulation, another option, or an option in addition to that, would be to rake up the dead needles and debris out from under the tree, as those dead needles serve as a source of inoculum to spread the disease among your spruce or fir trees. The final treatment option is the use of fungicides. And this would be a copper-based fungicide containing something like chlorothalonil that is approved for spruce or fir trees. And although it cannot stop the disease on needles that have already been affected, applying this fungicide in 2 to 3 timely applications can help reduce the actual spread of this fungus through the rest of the tree. 2 things to remember: the tree will need a thorough coverage of the fungicide, and also you may want to bring in an arborist if your tree or trees are very large, as they are trained to apply fungicides properly. I hope this information has been helpful in managing your backyard spruce or fir planting, and for more information, contact the Ohio State University Disease and Pest Diagnostic Clinic.